Welcome back to another mobility session with me. Today we're going to be focusing in on ankles and hips. The reason why I'm choosing this one in particular is I have been spending a lot of time getting up and down off of the ground to pick up the babies, play with them on the ground, and then ultimately have to get up and go change the diaper at the changing station. So that is why we are doing what we are doing today. The movements that I have selected are going to be an ankle stretch. I don't have a name that's proper for it, so we're just going to call it the ankle stretch. Up, down, in and out, combat base, and 90-90. We've done, I believe, the 90-90 in the past, and maybe even the combat base, but we're going to go over them again anyways. Nothing wrong with doing the same movements again. So, as far as the ankle stretch is concerned, you're going to be on hands and knees, and you're going to start just like this. The first thing that I want you to do, try to flatten your foot down as much as you can to the ground. Some of you might be stuck right about here, but if you can, you're going to try to flatten that foot down. And you're going to sit back onto your heels as much as you can. This kind of doubles as both a knee stretch, but mainly we're trying to do stretch out that ankle. Let's hold that for 20 seconds. Let me find my timer. Hold it for 20. Now, some of you might be stuck in this position right here. If you can even sit on up. And all you're going to do is just sit there and hold this stretch. All right, so two things. You're going to feel a stretch coming out the top of your leg, but you should also feel one almost like on the front of your shin. That's really what we're trying to stretch out. It's time right there. Now you're going to come on back up. Put your big toes flat on the ground, and you're going to try to sit again onto those heels. This one is going to be a big stretch on the bottom of your foot. Okay, so you're going to stretch that out. Hold this for 20 seconds. Again, some might be stuck right here, but if you can, try to sit on up. Now, why would you want to stretch out your big toes as you do this? Your feet have a lot to do with your ankle. Obviously, they are connected. So if something is tight on the bottom, you're probably going to be tight up top too. And then obviously that's going to keep on going all the way up. That's 20 seconds. Flatten those feet out, back down again. Sit back as far as you can. I'm going to hold it for 20. These are pretty common positions that I'm in with my kids so far. I mean, they're only 3 months old, so I'm sitting here playing with them like this. And then obviously if I have to get up, I'm going to be switching into that toe position. It's not really a whole lot to do here. Just focus on breathing. Stop that. We're going to come on up, flatten those big toes down again. If you can, sit on your heels. If not, stay in that bottom position. Hold it for another 20. But yeah, again, you're just focusing on breathing. Try to stretch everything out. Not a whole lot to really do here. And then that is just about time. And there we go. We're going to stop that. Okay. Ankles should be relatively stretched. We're going to move into up, down, in, and out. Got to angle myself a little bit better here. So with this, we're going to work on the muscles that surround the calf, right? So the front of your calf, the sides, and the bottom, right? Well, back, I guess. But what we're going to do is we're going to pull our toes up. We're going to pull our toes down. We're going to pull our toes in, and then we're going to go out, okay? That's what we're going to do. So what I want you to start with, bring those toes up. You're going to pull on up as much as you possibly can. Keep on holding it. You should feel you should start to feel a burn on the front of your shin and kind of a stretch on the back of your calf. Now we're going to go down. Try to point those toes that way as much as you possibly can. You might feel a stretch on the top of your foot. You might start to feel a cramp on the bottom of your foot. Totally okay. Just relax out of it and then follow back along once you're done cramping up. Now we're going to come on in. You're going to try to touch your pinky toes together, almost like you're rotating your feet like that. Hold it. Feel a stretch on the side of your shins or calves. And then you're going to go out. as much as you possibly can. Pretty close to the top of your shin, kind of where your knee almost connects with your shin. You might start to feel a burn. Come on up. Again, hold. Keep on pulling up as much as you possibly can. Come on down. Try to point those toes down. I'm starting to get a cramp on my left foot. This sucks. I'm so sorry if you are experiencing that too. Come on in. Really pull those pinky toes together as much as you can. And out. Really pull them away. Almost like there's little ropes and you're trying to pull your pinky toes up towards you. One more time. Up as much as you can. This is your last one. Keep on going. Keep on going. Keep on going. And down. Really reach. This is your last one. Come on. Breathe through this. Pull it in. Ooh, I'm getting a big cramp on the bottom of my foot. Yeah, this is the one thing that sucks about mobility. You tend to get cramps often. Come on. Out. Hold nice and tight. Hold nice and tight. And relax. Okay. Oh, man. Just try to massage that out a little bit. Move them around just a little bit. Get some blood flowing. Take a breather. Relax just a little bit. Doesn't mean, or you don't need to do a whole lot. Just sitting here should be kind of a relief. Okay. The next movement that we are going to do is going to be combat base. This is a personal favorite of mine. I have found this one to help quite a lot, honestly, with my squat. I used to get quite a bit of pain in my ankles and knees when I was doing this. And I found that it's actually, my calves were pretty tight, and this helps relieve that. So what you're going to do, be in a position similar to this. Now, if you can, I prefer to pull that foot in and sit down on that foot. Okay. From here, I'm going to lean over my knee as much as I possibly can. From a side view, I want to lean over that knee as much as I possibly can. Now, my heel needs to stay flat on the ground. I don't want to see that heel pop up, right? So you're going to keep that heel nice and flat. Lean over that foot. Now, this is where the mobility part of this comes in. Your big toe. Try to lift it to touch your shin. Now, if you are doing this correct, you should not be able to lift that toe up, right? So if I'm right here, say I'm leaning forward, I can totally lift my toe. You can't see a whole lot of it, but I can totally lift my toe. As I lean forward, my toe slowly gets put into the ground and I cannot lift it up. So that's how you know if you are adequately doing it. If you can lift your toe up, you got some more range of motion that you can go through. So you're going to lean forward, try to lift that big toe, hold for 3, 2, 1. Come on back. You're going to notice a big burn on the front of your shin. Perfectly fine. That's what we're hoping for. Again, lean forward, lift that big toe, quote unquote. 3, 2, 1. Come on back. Forward. Try to lift that big toe. 3, 2, 1. Come on back. 2 more. Forward. Lift as much as you can. I'm starting to get a real big burn. 3, 2, 1. And back. Forward. Lift. 3, 2, 1. And switch. One other thing that I should mention here is that if you need to, you can put a pillow, you can put something there on the bottom leg so it's not as painful. I'm on carpet, so this feels pretty decent for right now. But if you're doing this on hardwood or linoleum or something that is not a soft or compressive, or not compressive, yeah, I guess compressive. If it's not soft, it's probably going to hurt. So grab yourself a pillow or something, put a blanket under your knee, okay? Same thing. You're going to sit down, lean over that front foot. Don't let that heel rise, right? So if I'm leaning too far forward, that heel rises just enough that you start to get a stretch at your Achilles tendon. Try to lift that big toe. I shouldn't be able to see that big toe lift at all. If you can see your big toe lift, you're not doing this right. 3, 2, 1. Come on back. Forward. Get that big stretch at the Achilles. Try to lift that big toe. 3, 2, 1. Come on back. Forward. Try to lift. 3, 2, 1. Man, I'm really starting to feel this. Forward. Lift. 3, 2, 1. One more time. Forward. Lift. 3, 2, 1. Okay. Take a little break. We're going to do that again on the other sides, but we want to let that body rest just a hair. So one thing that I really do love about mobility in particular, and this always cracks me up with my clients, is as we're doing it, from the outside looking in, if you just watch this video and you're not listening to the cues that I'm giving you, and you just saw me doing this, you would think I'm just stretching and I'm not feeling any kind of burn. But when you're doing mobility correctly, you should feel certain target muscles start to light up, start to fire off. That's why I love doing mobility in person, because it always cracks me up watching somebody who's like, oh my goodness, my shin, it's on fire. It's like, yes, you're doing it right. Perfect. Okay, switch and do that side, the other side again. So again, sitting down, I'm going to lean over that foot as much as I possibly can. I'm going to try to lift that big toe. Again, I'm trying to lift my big toe up off the ground. Okay? As I lean forward, I should not be able to see that toe lift up at all. This should all be felt. The burn should be felt on the front of your shin. So lean forward, lift, 3, 2, 1, come back. Forward, lift, 3, 2, 1. Forward, lift, 3, 2, 1. Man. Forward, lift, 3, 2, 1. One more, I think. I think we're on 4. This will be 5. Forward, lift, 3, 2, 1. Okay. Switch on. One more time on the other foot. Again, lean forward as much as you can. Big stretch at the Achilles tendon. Try to lift that big toe up off the ground. If it is lifted up off the ground, it's not doing it right. Lift, 3, 2, 1. If you're doing this at home and you're curious if you're doing it right, one visual cue that you can actually have is right at the crease of your ankle. When you go forward, I'm telling you now, go forward and lift, you should notice when you lift, it's almost like something moves right at the crease of your ankle. It's really small, but if you look, you should be able to see it. Come on back, forward, lift, 3, 2, 1. Forward, lift, 3, 2, 1. On back, one more time. Forward, lift, 3, 2, and 1. Okay, there you go. We have now done the ankle stretch, the up, down, in and outs, combat base, and now we're moving on to the 90-90. This is another absolute favorite movement of mine. I know we've done this one in the past. We're going to do it again. You can never go wrong with doing too many 90-90s. Okay, caveat, don't do it all day. You'll probably end up hurting yourself, but do it daily and you should be fine. So bring one leg in, bring one leg out to the side. The way to know if you're setting up right is if you turn your chest to the front knee, there should be a 90 degree at that front knee and a 90 degree at the back knee, hence the name 90-90. If you don't see that, adjust yourself. Some people might have their foot in too far, or they might have their foot out too far. Make sure you bring it in to see that 90. If you don't know what a 90 is, you can grab yourself a little book, and typically right at the corner, there's a 90. Should be able to slide it in perfectly. Okay? Benefit of doing this right next to a bookshelf. So you're going to lean forward, hold, 3, 2, 1, come on back. One thing I need to mention is you're not bending at your torso. You're trying to keep your torso up. Lean forward, almost like you're trying to keep your chest up, like someone's talking and you are trying to look at them. 3, 2, 1, come on back. Forward. Get that big stretch at the glute. 3, 2, 1, come on back. Forward. 3, 2, 1. Come on back. One more. Forward. Lift. Oh, not lift. So sorry. Just forward. 3, 2, and 1. And we're going to switch sides. Cannot tell you how many times I've been working with clients and I have a little slip up like that. Thankfully, my clients know what I'm talking about. Again, setup. 90 in the front, 90 in the back. Make sure that you can slide a book in between. If you can't, readjust. Okay? Going to lean forward. Hold. 3, 2, 1. Come on up. Forward. 3, 2, 1. Forward. 3, 2, 1. Forward. 3, 2, 1. One more time. Forward. 3, 2, 1. Now you might be asking yourself, why is Donald counting 3, 2, 1s? It's an easy number to count, and I don't feel like doing it for much longer than 3 seconds. I'll be fully honest with that. 3 just seems to be that nice little happy spot. Okay, again, set up 90, 90, forward, 3, 2, 1, come on up. Forward, 3, 2, 1, come on up. Forward, 3, 2, 1, forward, 3, 2, 1, man, forward, 3, 2, 1, and switch. This is going to be the last one that we do for the day. Again, 90 in the back, 90 in the front. Turn the chest to be parallel with that front shin. Going to lean forward. 3, 2, 1. Forward. 3, 2, 1. Forward. 3, 2, 1. Forward. Try to find that stretch. 3, 2, 1. I think it's one more. Someone correct me if I'm wrong. 3, 2, 1. Okay. And that right there is ankle and hip mobility. So if you enjoyed this video, please let me know in the comments. Let me know what movements or lack thereof that you would either like to do more of or that you want to see more of. I'm always open to suggestions, but until then, I'm going to just continue to do I'm going to choose movements that I personally need to do until otherwise. So with that being said, thank you for joining, and then I'll see you guys next week.